Welcome to IntelliDocs. This video will explain how to do Computerized Physician Order Entry, or CPOE, for medication orders, and how to maintain the patient's medication list. In IntelliDocs, Computerized Physician Order Entry for medications is just another way of saying writing a prescription. To create a new script, click the Meds button on the toolbar or the Patient Notes bar. Remember, the IntelliDocs toolbar can be customized according to your job duties and your preferences, so your Meds button may be in a different position than the one shown here. IntelliDocs will display the patient's meds list, with active medications shown in green, prescriptions that have run out or lapsed shown in yellow, and prescriptions that were stopped highlighted in gray. Licensed personnel can write scripts by clicking the New Rx button at the bottom right corner of the screen. If you've been using IntelliDocs for a while, you've probably saved a list of the scripts you write most often to your MyRx list, and you're probably familiar with the Quick Sig Aid feature. But for now, let's create a medication order or script from scratch. Click either the Active Rx tab to see a list of all medications that your system manager has marked active for your practice, or the All Rx tab to see the complete drug list. The easiest way to find the drug you want is to just start typing its name in the drug field over here at the left side of the screen. Any medications that match what you typed will be shown at the right side of the screen. If there are multiple forms and/or strengths of the drug available, each will be shown on a separate line. Just double-click the one you want. Now you're ready to enter numbers for the day supply, refills, and dispense fields. You can either type a number directly into a field, or use the up and down arrow buttons at the right side of each field. The up and down arrow buttons beside the day's supply field help you enter values for typical prescription lengths. The first time you click the up arrow, the day's supply will change to 30. Clicking the up arrow again will change the number to 45, then 60, and so on. But you can always type a specific number right into the day's supply field. The refills field defaults to 0, but you can specify how many refills are allowed by clicking the up arrow. Click in the dispense field and type the number of tablets or other units that should be dispensed. The SIG field is where you type the instructions to the patient, such as take 1 tablet by mouth every day. Use the Allow Generic checkbox to indicate whether or not it's okay for the pharmacist to substitute generics for brand name drugs. If you need to prescribe more than one drug for the patient, click the Accept button near the bottom right corner of the window, and repeat the process to select another drug, to enter the day's supply, refills, dispense, and SIG information. And make sure that the Allow Generic checkbox is checkmarked if substitutions are allowed, and unchecked if not. We'll cover how to e-prescribe, or send the prescription to the pharmacy electronically, in another video. For now, let's just print the prescription by clicking the Print button to send the script to your default prescription printer. The patient's meds list will reappear with the new medications on it. Once you've created a prescription, the only change you can make to it is to modify the ending date if the patient uses less or more of the drug than planned. But if the patient stops taking the drug altogether, perhaps because of a reaction, you can mark the drug as stopped in IntelliDocs. You can also stop a drug if it was prescribed in error. Let's say that the patient stopped taking the Chloricon and that we selected the wrong dosage of Coumadin. We'll mark both of these drugs as stopped, then create a new prescription for the Coumadin. To show that the Chloricon is no longer active, click it on the list, then click the Stop button near the bottom left corner of the screen. Do the same thing for the Coumadin, then click New Rx, and create a new script for Coumadin with the correct dosage. When the meds list reappears, you'll see the 2 stopped drugs and the new active script for Coumadin. If you have any questions about creating medication orders in IntelliDocs, please send us email at support@busynet.com or give us a call at area code 918-858-4440, voicemail option number 2.